Welcome, everybody. Thank you so many people for joining us today for a very, very interesting talk today. I know there are a lot of people who are still logging in and they're going to miss out on the introduction, but that's what happens with a lot of these. So to start off, welcome to Collections Distancing, a webinar brought to you by the Collection Stewardship Professional Network of AAM and the Association of Registrars and Collection Specialists, ARCS. My name is Sebastian Encina, and I am the chair of CSAAM. Today, we have panelists who will discuss recommendations for planning the return to museum work, specifically dealing with collections work, although we will touch upon some visitor services logistics as well. In a minute, I will introduce the panelists, but first, some logistics. I will start with a message of hope and goodwill to all listening, and to all who are not listening. This pandemic has been hitting all corners of our society hard, taking its toll on all of us. Some have seen reduction in force, and some have lost their jobs outright. Some have lost friends and family, and to all of you, all of us, I wish us the best outcome. We don't know exactly where we will end up or when, but we will continue to work together for the best results possible. We are stronger together as we have so much knowledge, wisdom, and experience to share. Thanks to all of you who continue to share and be there for others. A disclaimer, our experts here will be presenting their expertise and knowledge, giving recommendations, but cannot comment on each possible scenario that is unique to your institution. Listening in, we have people who represent a variety of museums, different collections, different sizes, different circumstances, different levels of operation, even different countries. Today's panelists will provide some tools, as have others, and you will have to make the best decision for your situation. Today's session is being recorded. Once we have it, we will make it available on our websites. We're also over capacity for how many people we can host via Zoom, as we have over 1,000 registrants today. For those who experience trouble, there is a live stream via YouTube. Hopefully that is working. I was having some trouble with that a little bit ago. We will not be monitoring the YouTube page for questions or comments. We hope to keep this session to about an hour, but we may go over just a little. Our panelists are not providing slides for today's talk, so we cannot share those. However, Rebecca Kennedy and Ann Young have shared a document that can assist with many questions you have. They will present that document today, and a link to download that document was shared in the email reminder for today's webinar, sent yesterday and earlier today. And it's also available on the Collection Stewardship website. Please follow that link to save your copy, and in a little bit, I will post a link in the chat as soon as I can. The webinar does have a chat function. Everyone but the panelists will have their microphones and cameras turned off, but you can communicate using the chat box. We also do have a Q&A box. Questions for the panelists should be placed in the Q&A. Please use the chat to leave comments or to speak with other attendees. If you encounter any problems with today's webinar, see the Zoom support page or try emailing me. I may be on email, I'll try. I will not promise I know how to fix it, but you can try me anyways. Along with Rebecca and Ann's document, there are a number of resources available. CSAAM and ARCS have been gathering these and have made them available via our respective websites. There we have documents from a number of institutions, such as AAM, IMLS, CCI, Getty, and many others. Questions or comments about those documents should be directed to those respective authors. I do want to take a second to acknowledge CSAAM sponsors who have worked with us over the years and helped make our community stronger and a great place to collaborate and communicate and connect. They are great resources as you plan for future work. Today we have 4 panelists with us, and they will speak in the order given. We will have a Q&A at the end, though we may drop in some questions if they are relevant. We also invite the speakers to respond to each other as necessary. Dr. Preeti Malani, MD, MSJ, is a Chief Health Officer and a Professor of Medicine in the Division of Infectious Diseases at the University of Michigan. As Chief Health Officer, Dr. Malani serves as an advisor to the President of the University on matters of health and well-being of the university community, including disease management, public health preparedness and promotion of healthy practices, and climate on all 3 campuses. Dr. Malani is a graduate of the University of Michigan. She received her MD degree from Wayne State University School of Medicine. I will also add that Dr. Malani is a big fan of museums, holding membership to several. You may see her at some point in your own institution. And I also believe, Dr. Malani, that you just appeared on CNN not too long ago. So thank you for leaving them and joining us today.
Thanks.
Rebecca Kennedy has worked as a registrar and collections manager for 15 years at organizations ranging from historic homes to the Smithsonian Institution. She is now in private practice at Carre Collections Care, LLC. Rebecca also chairs the ARCS Emergency Subcommittee and is Chair Emeritus of the AIC Emergency Committee. Anne Young is the Director of Legal Affairs and Intellectual Property at Newfields, where she oversees the Rights and Reproductions Department and provides guidance and interpretation on a variety of institutional standards, policies, and procedures, including intellectual property, contracting, cultural patrimony, repatriation, and overall risk mitigation. Young received the Visual Resources Association's Nancy Deslauriers Award in 2017 for her editorial work on rights and reproductions, a handbook for cultural institutions, a second edition of which was published in 2019. India Crawford, a former registrar, has been in the art shipping industry for over 20 years. She's a senior director at Transport Consultants International and sits on the CSAM leadership team as a representative for shippers. In India, I think once a registrar, always a registrar, so not a former registrar there. Yeah. So thank you, everybody. I see that we have a lot of comments and questions coming in. So I'm going to turn the screen over to Dr. Malani. Thank you very much, Dr. Malani, for joining us today.
Thank you for the kind introduction, and thanks for having me. And yes, I am a big fan of the arts and of museums, and it's been something that I have just, in the last few years, I really tried to become much more engaged because of the importance of the arts to all of us, to well-being and to community. And you know, COVID has really brought rapid and deep change to every aspect of our lives, not just in healthcare where I work, but really how we learn, how we eat, how we travel, where and how we work. And the arts, including the museum sector, have been transformed by these changes, perhaps forever. I know people who are on this webinar are really from all over the world. I'll bring sort of my US perspective on COVID. And you know, as you know, things have really escalated in the last couple months. We saw the first cases here in January, and since then there've been about 1.5 million confirmed cases and nearly 100,000 deaths, and you know, many more that were not diagnosed. And fortunately, things have settled down, and in many states, including mine, Michigan, the curve seems to have flattened, and we're beginning to think about and approach the next phase of the pandemic, and that's what I'm going to talk about a bit. As things have improved from a public health standpoint, everyone is starting to think about re-engagement. And what does that mean? Like getting back to business. And when we think back to, at least in the United States, ramping down a couple months ago, it felt really difficult at the time, but it was relatively easy. We more or less flipped the switch, turned off the lights, shut the door, closed it behind us. But reopening is much more complicated. And I think that is very true for the museum sector and the arts in general. The timeline in terms of what's going to happen when is going to really vary depending on where you live, certainly within the United States, but also around the world. Businesses and workplaces are starting to open, and they look different now. And the locations are going to vary in terms of risk. We can think of things as like high, medium, low, both in terms of the type of activity that happens, but also the number of people that work in a particular given space. And for the time being, those of you who have been working remotely and can continue to work remotely, you probably will be staying that way. But you know what? It's pretty hard to curate masterpieces virtually. So it's going to be an interesting journey for museums. And just like the works of art within them, each museum will have special considerations, not just getting back to the day-to-day work of restoration and research, but eventually thinking about reopening to the public and doing it in a way that also is economically feasible. And that's going to be a big challenge for many businesses and certainly for museums. There'll be a lot of best practices related to things like access control, because who comes in, what happens when they come in, a little bit of a health screen. But that's going to become some commonplace in most places. Social distancing will continue. Cleaning and sanitation, we're going to just see an increased emphasis on that. Personal protective equipment, which again, I know for some of the work that some of you do in terms of the curation portion, the fixing of the masterpieces. I don't know exactly what the terminology is. You've worn personal protective equipment always for this because of the delicateness of what is involved. There'll also be a role for testing for COVID and contact tracing and isolation of workers. I would say one of the most fundamental things is going to be thinking about coming to work and not coming to work sick. And this is going to take place really in every community, workplace transmission and subsequent spread to the community. And you think about museums as the places where people come from all over the world to gather. So making sure employees don't come to work sick, and I'll talk about that in a bit. Also, coming up with a system where we can reassure our staff that it's safe to come to work, and each industry is going to have to sort of figure out what that looks like. There are some situations where you can't really socially distance. And again, I can imagine in my head that there's some activities that happen in your space that require two people to be working together, do things safely. But you can do things like screen workers, and you can screen visitors, and you can improve cleaning protocols, and you can use personal protective equipment along with decreasing density and social distancing. You can also limit the time of exposure. And hopefully you can do all of it in a way that just makes sense economically and just in terms of feasibility. I tend to think about the museums like I think about athletics, in the sense that with athletics, we can talk about return to training and return to competition as different things. And in my discussions with Sebastian, we talked about this a bit. And I know right now the focus is kind of getting back to the work, the day-to-day work that happens, not necessarily opening public, because that's going to be a little bit more complicated and it may take more time. Everything that I'm talking about is going to require shared responsibility. Not just employers and employees and people working in the museum space and visitors, but really all of us. And we're going to all need to work together. If I can just take a couple minutes, I actually saw this AAM document, Considerations for Museum Reopenings, and whoever did it, I don't know if you're on the webinar, this is really awesome. And I just want to highlight a few things without taking too much time to read this. One of the first suggestions is around coordinating locally, and I can't say enough about this. And it's often going to be your state health department, your local county health department, potentially someone like me, if you're at a university that has this type of role, but whoever it is that helps you in this setting and figuring out, because in the past you might not really have had to talk to that person that much, but having a coordinated strategy with other museums. Some of the things you're going to need to see before you can get back to work is really a good downward trend in local COVID cases. And Michigan, my home state, has actually achieved this, and we're beginning to get a timeline from our governor in terms of reopening. This is something that the White House in the United States has set as criteria, but seeing decreased cases for 14 days. Making sure you have sufficient staff resources, and as Sebastian painfully reminded all of us, this has been a difficult time, particularly for museums who've had to make decisions around furloughing staff, laying staff off. And as you start to ramp back up, thinking about bringing people back to make sure you can do the work safely. The prioritization of health and safety is really important. And some of the basic things, again, frequent hand washing. This is something that you've heard your whole life, probably something that you do with your own work because of, again, the delicateness of the work you do in museums. But having enough hand sanitizer, having enough soap and water and paper towels, ensuring physical distancing. And again, this is where the physical plant is going to be different in places, and your workspace may be different, and maybe there's going to be some barriers or plexiglass or different shifts and different hours, and just figuring that out. It's going to look a little different each place, but you can trade notes and figure this out. Providing enough protective equipment. A lot of places, including museums, took the opportunity to donate much needed equipment to the healthcare workers, which thank you for everybody who did that. But now you need your own supply chain to come back. And so that's going to be something that may take time. And as I mentioned, ensuring that sick people stay home and leave the premises immediately. This is something we need to socialize as a culture, like not coming to work sick, not because it's the right thing to do and like you're sort of not being tough, but because this is, in this case, could be life or death for people. Cleaning and disinfection is going to be very important, both with increased frequency and also having just additional resources. Ventilation is something that many of you think about with the work that you do, but some of the buildings are older. So making sure that ventilation is adequate. When we do get back to a more public-facing museum state, thinking about ticket sales and making things as little contact as possible, not using paper guides, things like that. One-way flow. And again, this document beautifully outlines a lot of the big picture issues. One last thing I want to point out is just providing adequate training for your staff. I think this hits on communication and as well as training. And these are things that people who are experts and professionals in the museum industry are very careful. They're very careful people because of what they work on every day. But I think the training is twofold. It's one, to just make sure people know the best practices around prevention, but also to make people feel comfortable and know that it is safe, in fact, to come back and begin some of these activities with safeguards in place. And that's going to be a harder issue, not because the safety isn't there, but because for the last few months we've been told, stay home, stay away, and just re-engaging is going to be a little bit of a challenge. So I'm going to stop there and pass it along to the other speakers, and I'd be very happy to try and take questions if there is time. But again, I really urge you to look at this document if you haven't. It's really very, very thoughtfully done, and I wish all of you good health, and I wish all of you the very best as you take this next big step on the journey.
So, thank you very much, Dr. Milani. There will be a time for question and answer later, but one question did just come up about masks and how long they should be worn. So if I'm at work and I'm saying working like an 8-hour day, do I just keep wearing the same mask for the straight 5 days, or do I need to clean them? How often?
Yeah, thank you. And I didn't mention masks, so thank you for bringing that up. Masks are going to be part of our shared culture, especially in enclosed spaces. You can argue about whether they really need to be used outside, but even there where you can't socially distance, it's just a respectful thing, I feel, to wear a mask. But indoors, many of the states actually have guidance around this. So I would say for most of you, a cloth mask is going to be okay, and for usual use. Now, working with works of art, you may need a special mask and you may need eye shields and things, but in terms of prevention of COVID, a plain old cloth mask, and there's a lot of guidance out there on what to use. You can buy them, lots of places people are making them. And the idea is you're covering up your own secretions. So if you have infection, you're not going to spread it as likely to other people. And I would say is if you're not able to maintain 6 feet of distance, or you're not in your own office, or you're not in a more private space, you should be wearing these masks the whole time. That's a little difficult, go outside, get some fresh air, take off the mask because it is uncomfortable for some people. But what I would say is with the cloth mask, use it for the day. If it certainly becomes soiled, you should change it out. And then, wash it at the end of the day and keep a couple of them on hand. So being practical.
Okay, thank you so very much for that. And we're going to have a lot of questions for you as the hour progresses. And then I have a lot of other questions, but thank you. I think we're going to turn it over to Ann Young and Rebecca Kennedy now. And I can stop my screen share if you would like to share your screen.
Okay. Thank you, Sebastian, and thank you to the Collection Stewardship at AAM and to ARCS for hosting today's session. It's really great to be here. So before I turn this over to Becca to kind of start talking about the beginning portion of this checklist, just want to give an acknowledgement. This was a very collaborative process to put this checklist together, as Becca knows. So it's something that Becca and I worked on to really make this a general use checklist that could be implemented by any type of cultural institution. And the various scenarios within this checklist, which we'll get to in a few minutes, really grew out of the very extensive work of the overall pandemic operating team at Newfields, which I am a member of. So I'm happy to talk about that a little bit more in a few minutes as we get there. But right now I'm going to hand this over to Becca and let her talk about the first few pages of this.
Hi, again, thank you for having me. So when Anna and I first talked to each other about creating this document, she was already well into this plan with the pandemic operations team at Newfields. And I just sort of came in to help integrate a checklist that I had already started working on specifically for collections managers and registrars to start coming back into the office, but also wanted to sort of help put a process into the reentry and the reopening. And this was the motivation of this product that you have now. But one thing we were really looking for was creating a theme. And no matter what scenario you're faced with, because they're all going to be different based on the type of institution, your state laws, your reopening plans for your local governments and health officials, that as long as you follow these 5 steps that we have separated these reentries processes into, you will succeed. We wanted to make sure that you had proper activation. You all did by your own department's proper assessments. And the reason for the assessments is to make sure you don't have competing resources, you don't have competing chain of commands, and you don't have problems with across purposes. So doing these assessments before you even begin, really letting people come back into work to begin work, it actually will make the reopening go much smoother. So once you're back at work, that's when we get to site stabilization. Once the site is stabilized, and there's very many different examples of what we mean by that, then you can reopen. And once you reopen, the situation analysis continues because you're going to continue to get more information. The laws and health experts are going to continue to change their opinions. So as long as you follow these 5 steps, it's going to be great. But yeah, and if you can scroll down, we'll go to the next pages. So the document really encourages you to do this together as a team. No one should do anything in isolation or alone. There's too many variables. You can go to your outside health officials or your outside emergency managers, local officials to help you if you're a small institution. But what we wanted to do specifically for collections managers and registrars was to talk about what you can be doing before entry, during reentry, and after you get there. So this is very basic information. You're probably thinking, duh, I know all this, but you're going to be so stressed out. You're going to be so overwhelmed, having people coming at you from all angles. We just want to make sure you have it all together. So again, this is very adaptable. This is, and correct me on my terminology, this is like proper use for them to adapt and change the way they want for copyright reasons. So make this work for you as your institution. This is just a template and a starting point. So we have before entry, we really want you to consider health and safety and communication. How are you going to communicate to each other? Then reentry, this is very simple, but we're getting to that assessment phase. Look at your environment, look at how things have changed or altered while you've been gone, look at your pest, make sure everything has been maintained. If maintenance has not been kept up, what can you do? And that goes into your site stabilization process, which is next. And then, check on loans, acquisitions, integration, installation, all this stuff but we just wanted to remind you about it. It's a very simplified checklist. And then we provided you some handy dandy resources, which are constantly being updated. So really feel very strongly that this document will work for you. Anne, you want to take it a little bit?
Sure. So from there, and as Becca said, in terms of copyright licensing and use of this, so we have put this out under a Creative Commons license. So please take it, adapt it, use it, work it for your own institution. We really tried to open this up as much as we possibly could. And be applicable to a number of institutions. And so that was something that, as I said, working as a member of the pandemic ops team at Newfields, and working really closely in particular with our COO, Katie Haig, on this, and a lot of research going into this, and realizing as we were working through a very Newfield specific version of these scenarios, and to some degree reverse engineering what our closure was. And so we had some planned scenarios as working towards closing down the campus in response to COVID-19. We moved through those scenarios significantly quicker than I think any of us anticipated. And so really trying to think about reopening and our reentry, and basically taking a reverse engineer approach to those, thinking about what triggers apply for us to move into various scenarios. So we developed out 3 different scenarios, and what you're seeing here is really this kind of very general version. So as part of working on this and in conversations with Becca, we realized that one of the wonderful things about Newfields is that it has a variety of things to it. We have an art museum, we have an art park, we have gardens, we have 2 different historic homes. There are a lot of cultural institutions that are just one of those things. And so we realized that with putting together this reentry scenario and working on with our ops team, that we were actually thinking through what could be reopening scenarios for a lot of different types of cultural institutions. And so kind of, stripping out obviously some of the terminology that was very specific to Newfields, and really making this a document that we hope can work for a number of institutions. I think we might not have as much applicability necessarily in this for zoos, but we do have, some of this stuff to take into consideration with living collections and with the garden in our park. So within these 3 scenarios, scenario 1 is actually what is phrased as being a full reopening and a return to, quote, normal business operations, whatever those might be, putting in what a trigger to be able to move into that type of a scenario would be. So it works through everything from being able to have, taking through those 5 steps that Becca talked about and breaking these down a little bit more department by department. And then I would highly encourage any of you that are working with this document and looking to adapt this for your own institution, that then once you have this very high level document prepared that takes those 5 steps, breaks them out kind of with high level action items for departments, pair this then with very detailed step-by-step instructions that each department needs to put in. So, having things on here such as, prior to reopening, where you have collections and registration and conservation staff coming on site to assess galleries and storage areas and new labs and anything like that, thinking about what does that actually look like? How many of those staff members is that actually going to be? When are they able to come on site? How often do they need to be on site? When can we stage things out? Working through every single department, making sure you know who's notifying any outside partners. If you have any outside groups that you work with for festivals, for food service operations, for a cafe, for any retail operations, make sure you're in constant contact with them so that all of your guidelines match up. Having those discussions with local and state health departments, making sure that the plans that you're looking at putting in place do follow what your state is thinking about. So this kind of scenario 1, again, that kind of first, really the most open version of what that would be. What does it look like for site stabilization? Really, then, this is that high level catch-all document that then you can really delve into with separate documents that will be, aligned with this. Important within any of these is thinking about, the things you need day of, but remembering that within any of these, just because you've opened and turned everything back on, you don't get to step away and stop paying attention. We could be in a situation where you would have to reclose, or perhaps you shift back a scenario into a partial reopening of different parts. So the next two scenarios, I'm not going to really go through those in too much depth, but they are really just a partial reopening in some capacity, perhaps with greater limitations on number of people, perhaps not opening everything quite yet. And then the third scenario that's listed on here that is the most limited form of reopening. In this case is really looking at opening up outdoor spaces only. So for Newfields, that'll be opening our garden and the park, but maintaining at that point that the galleries, the historic homes, any other outbuildings and things will be remaining closed. So kind of thinking through what these different scenarios would be, and really, again, please, take this, adapt it, use it, build upon it, but remember this is kind of that high level catch-all, where you can have every department broadly listed and encompassed, and then pair that with, the very step-by-step instructions would be in a separate document.
Yeah, and we realized when we wrote this, not every cultural institution has this many positions, and many of you wear multiple hats, which cover a lot of these positions, but it made more sense to divide this out to adapt. So again, if you're a small institution, don't think this doesn't apply to you because you don't have all these positions. Change whose name would go in those spots. And I just want to chime in that this layout of this assessment site stabilization is actually based on the ICCROM First Aid to Cultural Heritage in Times of Crisis framework. And their handbook is available for download for free. It's not really based on a pandemic, but it's a way to approach every emergency. But this is an emergency. So for all of you that are having problems with institutional buy-in and getting your administrators to realize that a planned approach results in safer and more sustainable results, this is the same as doing incident command systems training, or doing any sort of emergency training. A systematic planned approach will always get you better long-term results than a fast and haphazard approach. ARCS did a webinar last week on COOP training, and we did bring in an expert on institutional buy-in for collections managers and registrars, Becky Fifield, who does a lot of information on this. So hopefully that helps. I'll share in the chat box the link to the First Aid to Cultural Heritage in Times of Crisis handbook, downloadable for free in PDF, please do. And institutional buy-in, if anything, make them take the ICS 100B training, which is training for incident command systems, because I need to understand there's a systematic planned approach for all emergencies, and this is an emergency.
Okay. All right, let me see if I can stop the sharing here. All right.
So thank you, Anne and Becca. I think one of the things, and I'd like to get some of the other panelists to talk about this as well. You had mentioned that it takes a team, that nobody can work on this alone. I'm curious your reaction to, I have a colleague who is making plans at their institution, but they instituted one person who gets to be in charge of deciding who gets to come in, whether that's the director, associate director, somebody, as long as there's somebody who can oversee all the various departments and but can have the final say of this department needs this on this certain day, so therefore these people can't come in to maintain that social distance. And if there's any fight back and any kind of pushback on that, that person has a final say of no, this team or these people or this person can't come in because of some other needs.
Yeah, I think that could be harder if it's just up to one person, because I think it's, hard to assume that one person at an organization, maybe unless you're really small and you have like fewer than 5 people there, really has a sense of all the different departments and their needs and priorities, and who still has work that they can do from home, who needs to, their work is really dependent on them being on site, and then how do we stagger that workflow. Again, I know for us having the very cross-departmental ops team is really working to inform this more detailed opening. And as we're planning on getting staff back on site and moving into this kind of our very first version of opening, that will be more limited, likely looking at opening just the garden, opening our park, you know, trying to institute what we can for one-way traffic, no paper tickets, everything online, no cash transactions, and then really thinking through the scenario of moving from where right now we're at essential staff only on site. So that's members from security, select members from facilities, and occasional other staff from different departments. I think probably the largest other department really represented on site right now is our horticulture team, needing to still be on site to make sure that the living collections aren't dying. But moving beyond that, and as we're moving into this next stage and moving what we're kind of referring to as essential staff plus, and that really is the ops team looking to the managers and supervisors and the heads of different departments to inform and say who really needs to be coming back at this point, where we can start bringing more collection staff back on, staggering work hours, having staff come in on alternate days, reducing how much they are in the office. So we're really working through all of that right now to try to figure out what does that look like. Whether it means that we have some departments working kind of more in shifts with a shift A and a shift B, and making sure that those shifts are always consistent people. So if they are ever around and having to work in closer proximity, they're always working with, say, the same 2 to 4 other staff members in their shifts. And that's always who they're interacting with if they are going to have to be in closer proximity to one another, just given the nature of their work. But otherwise really working in, you know, where do we have people in individual offices? Can we stagger the days they're in? Can we stagger how much they're there? And really encouraging and making sure staff understand that when we move back into this stage where we're able to reopen the garden and the park, it doesn't mean that we flip the switch and everybody gets to come back and work on site. And that broadly, it's still going to be the message that if you can do so, you keep working from home. But we'll have, I think, probably looking at fewer restrictions to being able to come on site if you're like, so there's this one thing I could be working on, but I left X in my office and it would be really great if I had that and I could keep working on this project. So I think it's really important that, and that's one of those, you know, on the ops team, we don't have the information for all of the departments to know what specifically they need for their workflows, who needs to be in there, who works well together, who needs to work together versus, you know, somebody just coming down and saying, okay, you know, these 4 are going to work together, and it might not actually make sense for those 4 to work together, or I'll have them all on site if need be.
And as Becca said, this is an emergency, so you can turn towards your emergency preparedness plan, and if you don't have one, now is a really good time to get started on that. And the response, maybe your walls are not, you know, there wasn't an earthquake, wasn't a hurricane, wasn't that kind of emergency, but how you respond to this is definitely that as well. Very interesting, you talk about the teams working together. I believe India is going to touch upon there's a new group, Art Services Worker Safety Coalition, and they mentioned this for their trucking and shipping people about how they're working as teams as well. So I'm sure we'll hear more about that and we can ask some questions. So any final words, and Becca, before I turn it over to India?
We're here to help you with the checklist, so let us know. And we actually want to hear back from you if it works or not. So thanks.
Yeah, so the document was shared in the chat. So if you don't have it, check the chat, check the email that I sent earlier. It's also on the Collection Stewardship website, and I'm sure it's on the ARC's website as well. So thank you all very much. India, so not only do we have to do work within the museum itself, but we're also talking about how we're starting up with loans and shipment and trucking as well. So India Crawford is going to give her perspective on that side of the museum work. So the screen is all yours, India.
Thank you. Thanks for inviting me to participate. As staff returns to museums and galleries, there are questions about shipping arising, especially for those who have shipments that were halted mid-transit because of the pandemic. And some of you might have participated in other virtual meetings over the last couple of months, so you know that the safety of art handlers, clients, and collections has been a hot topic. Institutions should know what logistics companies are doing to protect their employees, protect the people they come into contact with, and how these protocols are affecting the services and the transactions. And logistics companies should share what they're requiring of clients in advance of jobs so that everyone's on the same page. Some companies' policies and protocols are very specific and outline procedures in detail, and others are much more general. The Art Services Worker Safety Coalition did publish guidelines on Monday. There might be more consistency in these various companies' policies going forward. The guidelines are published on their website along with a suggested chart of PPE use, and that's artservicesworkersafetycoalition.com. But here's some summary of some of the information that we've gathered from various companies. PPE, sanitizing, and cleaning. Every company we've been in contact with is outfitting their technicians and drivers with masks. Some are requiring gloves, and others are requiring disposable shoe coverings. It really varies from company to company. Some companies are requiring shippers and consignees to also wear PPE. In this scenario, if a museum, gallery, or private collector doesn't have their own PPE, the company's responses vary. Some technicians will have a small supply of PPE to provide. The job could be rescheduled, or others will require staff or the collector to vacate the area to allow them to work safely. And most companies have outlined a cleaning or sanitizing procedure. For instance, most vehicles will have hand sanitizer for the technicians. Companies have also created schedules for the cleaning of vehicles. Some steps to be completed after every job, some at the end of the day, and some at the end of each trip. And the procedures vary from wiping down tools and door handles to wiping down the entire cab of the truck. And everyone is expected to practice social distancing with that minimum of 6 feet separation. Obviously, it doesn't apply to the dual driver art handler teams. The vehicles don't allow for separation. They're spending all day together. But some companies are trying to keep teams together and in the same vehicle to mitigate cross-contamination. And some companies have determined that if 3 technicians are required for a job, that third person will drive separately instead of riding in the truck, which is what they would have done 3 months ago. Because of social distancing, we do expect tasks to take longer. And in addition to the standard 24-hour ETA call, some companies are asking their drivers to call on arrival to allow the client to open access points and to confirm that there is room for them to work, to handle the objects, move in supplies. And this is obviously easier in larger spaces and might be more difficult in smaller places, such as a private residence. And even if a private collector does have their own PPE, some companies are asking that no more than 2 people in that residence interact with the crew. And social distancing can look different when handling one crate or object versus an entire exhibition. Can the object or objects be placed in an area away from staff so that the technicians can collect it without infringing on the 6 feet? Is there space for the crates, the staff, and the technicians? And how does social distancing affect on-site services, such as packing or unpacking? And what about installation? And is there the space to perform these tasks safely for the objects, the art handlers, and the clients? And if there isn't that space, companies will perform such tasks such as packing, like in the back of the truck, which is not something that would normally be done. On-site services in general are, for now, are on a case-by-case basis, and we'll see how that changes as we move through this. If a job cannot be performed because of the lack of social distancing, most companies have instructed their technicians to stop work and call the office. Obviously, in order to avoid this situation, the more information provided to the art handling company in advance, the better. I think communication is key. And in addition to the art handlers in the field, companies are also creating policies to assist with employees in the office, such as creating a rotating schedule to minimize the number of employees in one place at one time, implementing rules such as no sharing of tools, and creating work groups so the same people are working together on a regular basis, which limits contact with other employees. As far as couriers, I don't know of a company that is currently accepting couriers on their trucks. Follow cars are an option if a courier is necessary, but I'm not sure how that looks with social distancing with a courier in a car with 2 drivers. And when companies do start to allow for couriers, I'm sure there'll be additional safety protocols specific to having a courier on board. Paperwork. We know the bill of lading for all of us is an important document. It authorizes release of the shipment, confirms delivery. It can list everything from piece count, dimensions, and in terms of insurance in some cases. We're suggesting everyone provide their own pens to sign that document. There are companies that have ordered thousands of pens and plan on handing out a pen for each transaction, and then they'll just keep the pen after they've used it. Other companies are requesting that institutions have a table or some sort of desk area set up by the loading dock, so paperwork can be placed there, art handler would step away, museum staff would step forward, sign, and there'd be this sort of dance around this paperwork. But again, extra steps that need to be taken to allow for social distancing. There are some companies that are allowing for electronic acceptance. For example, with prior approval, the client can request the drivers print the client's name on the bill of lading, and a copy of that bill of lading will then be texted or emailed to the client. With another company, a client can email confirming release or receipt and specifically reference that bill of lading. Some companies will end up using tablets that can be wiped down after each transaction. And there are some companies that are not requiring any signatures on paperwork, simply taking a photo of the objects in place at pickup, and then once it's delivered, taking another photo, and that's their proof of delivery. I think the key here is everyone involved in this transaction needs to be aware of the procedures in advance and in agreement with them. And this pandemic might force the industry to change how it deals with paperwork going forward. Maybe an electronic signature will become the new normal and the old forms and triplicate will go by the wayside. Monitoring health. Some companies are asking the drivers to take each other's temperatures while on the road, especially for the long haul drivers that are gone for a week or more at a time. And there has been discussion of setting up a quarantine area in the warehouse for handlers returning from the road. Some companies are asking clients questions about health and recent travel. Have they been ill, been in contact with someone who's been ill, traveled to a specific country? And for those companies that have this policy, a yes answer to any of these questions could lead to the job being rescheduled. Warehouses and storage facilities are open. Most companies are offering access to clients by appointment only and further restricting interaction. And as for releasing and receiving, some warehouses are not allowing anyone but employees on their dock and in the receiving area. And then to further reduce interaction, if a company has multiple loading docks, some are allowing only one to be used at a time, or say every other dock to be used just to create more space. And in summary, I think there are 3 words that we need to remember as we deal with this: patience, transparency, and communication. Patience as we figure out how to navigate this new normal. Patience as tasks will take longer with social distancing. And patience as schedules change, for example. Transparency and communication. What is the safety protocol of the art handling company? What do we expect? Are we comfortable with that physical interaction? Comfortable with the bill of lading process? And can we as an institution also meet the requirements of that specific art handling company? Just one final note, I assume protocols will change. Most fine art companies are just now restarting operations. So these policies and procedures have not really been in place for more than maybe a few days. So I expect there to be changes as we determine what's really working in the field, what's practical, and what isn't working and needs adjustment. So thank you.
Thank you very much, India. There are a million questions that come out just from what you were talking about there. But we can't ask all million questions. I do have one question that might apply to all of our panelists now. And thank you all very much for speaking. But a question came up and I was ahead about when we have art that's going to ship, how long might a virus live on a work of art? I know that it can live, let's say, on paper for so many hours, on masks for longer. But if we have someone who's going to come to create something and then take it away, do I, as a registrar, need to set it aside for a couple of days? How long? How much time should we give for shipping, for preparation of artifacts, so that we make sure that it's no longer contaminated? And whoever wants to jump in that question, please go ahead.
You know, I can comment a bit. And first of all, you know, Anne, Becca, India, wow. Really, really great advice, and that advice could be applied to most workplaces. You know, I'm going to say something that probably is going to surprise you, but the whole role of the environment and like an artifact causing you to get COVID, it's pretty darn unlikely. Doesn't mean like we shouldn't care about our surfaces or that we should just, you know, not pay any attention to it. But you know, even though virus can, you know, this idea that we can find bits of virus on things, the infectivity is extremely low. Like even after 24 hours, people are not necessarily getting sick in that way. They're getting sick person to person and in close contact. By and large, even the role of asymptomatic infection and spread is really difficult to quantitate. People are very contagious, often right before they develop symptoms, but there are people who never have symptoms, and they don't tend to be super spreaders, most of them. But there's all this unknown, and I feel like there's a lot of focus on, oh, I'm going to put this aside for 7 days. And to me, that feels a little excessive, and we won't have time to address all the questions and answers, but you know, you all are working in close contact. And I love the idea of keeping people in cohorts. It's a little bit like a daycare, you know, in the sense that you've got kids and like you try to keep them with one teacher and, you know, you're not trading toys and things. You know, it's like a daycare, right? But, like a fun, really fun daycare with very delicate toys.
Much more fun toys.
But you know, this is what this all comes down to in terms of quarantine in households. And like, as we're going to start branching out, we're going to limit. We're not going to like have the whole block over. We might just decide we're going to spend time with our neighbors because we really like our neighbors. And I think it's a little bit like that here. I actually am not that worried about putting the artifact aside. You know, put it aside for 24 hours. You guys are like crating the stuff up. People are not, that's not the big risk in my mind. And also I just wanted to comment, the gloves, if you need them for your work, but in terms of gloves being somehow a safety issue, working in the space, it doesn't really make sense because it's easy to contaminate gloves. We do need them in certain settings for safety and including the healthcare setting, but most important thing is wash your hands, don't touch your face, don't touch your mouth, don't touch your eyes. I'm fine with face shields. I think that they could give you protection for a couple reasons. There's some people who are really, really strong advocates of face shields. I'm not sure if everyone should be wearing them, but in a close contact with a mask and a face shield, and potentially something to cover your clothes more because you're dealing with these precious things, and not even, and maybe you are in close quarters. And what I'll just close by saying and then I'll move aside, is we can do everything to decrease risk. We can't eliminate it. And I think that's where you want to be. Right now, we're at a good point in a lot of places in the country. This assumes that there's not widespread infection everywhere. And so, you know, your risks of not doing this work is also great. It's important that this work continue, and that this is a very important part of our humanity to keep working on this, but we need to do it safely. And I think you could do everything that we've talked about to decrease, mitigate risk. You won't fully eliminate it, but I think you'll get to a good place.
Thank you. Anybody else want to chime in on that question on time? No. So one of the things that has come out of this, and there was a question earlier about things that can't be moved by one person. You talk about working together as teams, so that will mitigate the risk as well. So it kind of sounds, Dr. Milani, that while we're all trying to keep that 6 feet, about 2 meter distance from each other, as long as we're cleaning up after each other, making sure we don't come in sick, and wearing the PPEs when necessary, that seems like less of a risk then.
Yeah, I think in general, you want to try to have a situation where you can maintain social distancing. For short periods of time, you're going to come in contact with people, and that's okay. This happens in the healthcare setting too, right? Where we are in contact with people, but we're trying to do it in a way that's responsible and like sort of a need to be in contact. And there was a question about installing art. And again, right now where, you know, things were not as public facing, you know, maybe you have the people who are installing working together all the time, and you have to, you know, maybe one person can install. I'm not sure if that's a complicated technical question, but, you know, just being smart about it and limiting how much time you have to be in close contact. But this idea that you can always be 6 feet apart no matter what is also not, I don't want people to be afraid to just, like, you know, you walk by someone, it's the amount of time, like unless you're with someone for an extended period of time, you're not going to usually spread. And wearing the mask, that's all of that helps decrease risk.
Okay. And also some decontamination. As we return to work, we are going to be sharing some bathrooms. We're going to try to limit that, but just wiping down from there, that should help with that as well.
Yeah.
So you don't have to worry too much. Like, I get the bathroom on Mondays and you get the bathroom on Wednesdays, kind of thing.
Yeah, and I think you want to have frequent cleaning, which again, your beautiful document discusses that, and the CDC guidance does. You know, you just want to increase your cleaning protocols, and you know, by having fewer people, you're going to have fewer people in the restroom. And this idea that only one person can be in, and how many people, I think it gets a little complicated. Most of you are in situations where you're not going to be overcrowded, that you can have people working remotely and shifting in, and maybe working one day and not working remotely one day. And, you know, I think it's going to call for creativity, and that's what all of you are. You're all creative people. So I think you're going to teach the rest of us how to do this.
And a kind of legal kind of question. Sorry to put you on the spot, but let's say we start reopening, and even to visitors, let's say someone refuses to come in and a museum wants visitors to wear PPE. Can museums restrict people from coming in if they refuse to wear them?
Of course, as you already prefaced earlier, not giving specific legal advice at all, but yes. So usually at the end of the day, that is, you know, the museum, your institution, your private property most of the time at that point. So you are able to, as an institution, you know, make that request or strongly suggest in some way. You know, so I think that is a matter of, you know, discussion for the teams at museums and their senior leadership and the boards to say, you know, is this something we're going to require, or is it we highly suggest it? I think it's a little bit easier for institutions to say that we're going to require the use of PPE amongst more staff than what we can for visitors coming to our institutions. Within any of this and any accommodations that we're making, I think it's just kind of important to point out that any of the other laws don't go away as we're working towards this. Needing to be compliant with ADA, with HIPAA, thinking about OSHA regulations, that's not changing or going away. We still need to be compliant with those things. We don't get a pass just because we're trying to figure out how to reopen in the midst of a pandemic.
Thank you. It is about 4:01. I don't want to keep people too much longer, but I didn't know if anybody wanted to answer any of the questions that came in through the question and answer, or anything that's relevant, pertinent, that we think needs to be mentioned. As Dr. Milani mentioned, a lot of the questions do come on artifact care. Clearly, we don't want to start disinfecting our collections, but it seems like that is less of a risk. It's more that person-to-person transmission. So we're not going to start spraying down our Monets or anything like that. Dr. Milani, it looks like you have something to say.
Yeah, I would just say, hopefully people aren't really touching the artifacts either, other than the very trained, as needed. And again, just to kind of follow up on Ann's point, this is all like, there's not a clear playbook on this, and I would say work with your local health department, work with your local OSHA, your environmental health and services. Suggestions I'm giving are really sort of general practical tips, but each place is going to be a little different. Each country is going to be different, and do what you need to do to keep the work going while we wait to get back to something normalcy, because we really need the museum community to be there when we get through this.
Yeah, I just wanted to add that one of the things that we really promoted on our checklist was that part of the reactivation was that you need to have a safety plan, so that there is consistent rules for everyone's safety, so that you don't have someone from the director's office telling you don't have to wear a mask, but someone from the education department telling you do have to wear a mask. So that way the message is the same. So everyone's doing the same, and you're talking to your visitors the same. That way there's less of this concern going in. And if there's not a safety plan and you don't have the PPE you've been promised to do your job, then you don't need to go back to work. It's a worker's rights through OSHA that you need to be protected by your employer. So do a safety plan, make sure they provide you with PPE they're requiring, then you can go back to work.
Becca, I think that is such an excellent point you make, because a lot of this does boil down to communication and making sure that you're not hearing one thing from one source, one thing from another source. Dr. Milani, you mentioned earlier going to your local organization, whether it's a campus, the county, the state, making sure that the same message is going from top down, or from you to the president to the dean of our college on campus here, making sure that it is all one message, that we're not hearing a million things. So thank you very much, Becca, for bringing up that point, because that is so important. And one of the ways that we further flatten the curve here is communicate with each other, make sure we have this plan and that everybody knows what's going on and what's happening. I know that we have a million questions that we can keep asking, but I can't keep everybody here for forever. So I want to thank everybody for attending today's session, and especially to our panelists, India, Preeti, and Becca. Thank you so much for your words and your expertise. Please remember, this was recorded, and we will make this available as soon as it is available. And I know there may still be many questions left. You can send questions to me, and I will try to get to them, asking our panelists to chime in as they can. But as I stated at the beginning, we cannot comment on each scenario. As you are the expert for your own situation and have greater knowledge than we do about your museum, your collections, take the tools that Becca and AEM and others have provided and do what's best for your specific situation. Be sure to visit the ARCS and CSAM websites for resources. Also visit the AEM website. We've collated some of those things from Getty, from CCI, from IMLS, and other organizations. So you should be able to find quite a bit there. And if you find anything else, be sure to mail to me, and we can upload it as well. Again, thank you, everybody. I hope this was useful for everybody. I know it was very useful for me. And I wish everybody a lot of health and safety. So thank you again very much, everybody. I hope you all have a wonderful rest of your day.
Thank you.
Yeah.
Thank you.
Thank you.